Good morning. This is Eric Kronengold, Executive Vice President with HealthiestYou. Thank you for joining our national call. We're looking forward to an exciting call today. We've got a great program set up for you, and we're really looking forward to 2016. If you're a member of HealthiestYou and you've already been producing with us, we really thank you for that. And anyone new joining HealthiestYou, you're going to see a lot today. We're going to really show you how to build your business. We're going to show you how to trim the fat out of your clients' existing health plans. It's kind of a precursor of what we're going to be talking about today. But it's just an amazing time in the industry. And those of you that have implemented HealthiestYou with some of your new and existing clients, you really know what we're talking about. But it's because of all the brokers, consultants, partners on the phone today. HealthiestYou is just exploding. And we really want you to be part of that explosive growth, where we're going to show you how to use HealthiestYou to really complement what you're doing in your existing health plans, to solidify yourself, to open doors, but really make a difference out there in the marketplace and create a phenomenal revenue stream for you at the same time. So because of the growth and because of what you all have helped us with, we've actually doubled our membership in January, which was amazing. We were named one of the Inc. 5,000 fastest growing companies in the U.S., and it's because of brokers and consultants like you that have really, really exploded HealthiestYou onto the scene. And we're looking forward to that growth. It's continuing in 2016, and we really want you to be part of that. We're going to show you how, and we're going to show you the tools. We're going to show you the service that we have, but also we're going to show you the phenomenal team that we have behind the scenes. The team that you have behind the scenes at HealthiestYou, we couldn't be any more proud of them. We were actually named recently as one of the Business Journal's best places to work in Arizona. And if any of you have worked with HealthiestYou and seen the team that surrounds us here on all sides, sales, operations, client success team, they will make you look good. It's not just talk. It's not just everyone says their employees are the best, but ours are the best. And our employees are really an extension of your firms and your clients. So we'll be out there making you look good, making you proud to bring HealthiestYou into the different groups that you have, whether they're new or they're existing clients. So HealthiestYou itself, and what I'm going to do today, we're going to talk about HealthiestYou. We're going to go through kind of an overview of the service. We'll go through a demonstration of our new app. And then at the end, we're going to bring on Patrick Kelly. He's with a very large general agency. And we're going to talk about how HealthiestYou, how they use HealthiestYou to design benefit plans and how it's really impacted their agency. So let's get started with HealthiestYou itself. So HealthiestYou, if you're not familiar with HealthiestYou, we don't like to just view ourselves as a telehealth company. We really like to view ourselves as a member engagement or an employee engagement company and a claims redirection company. So if you look at the overall service that HealthiestYou brings to the table, we want to look at a little bit of history of some big popular companies. So if you look at HealthiestYou and you look at some of the competition or the different types of companies that are out there, Airbnb they're one of the largest providers of real estate, but they don't own any real estate. Facebook, everyone knows Facebook, the most popular media owner, but they don't create any content. The world's largest taxi company, Uber, they don't own any vehicles. HealthiestYou, we are the king of healthcare consumer engagement, and we're going to show you what that means. But we actually don't own any clinics, but we're able to connect in a powerful, powerful way, and we're really able to engage our employees, educate them, remind them on a constant basis, but then really simplify healthcare. So how do we do that? We have one of the first platform that really shifts consumers from expensive, inefficient healthcare points, and we give them the services they need right at the point of time and need conveniently. So the technology that we have behind the scenes is anybody can access our service. It doesn't matter. People ask us all the time, who are the best candidates for HealthiestYou? And the real answer is everybody. It doesn't. When we first got in this business about 8 or 9 years ago, we kind of thought that we targeted certain types of groups. But what we found over the years is it doesn't matter who it is. it can be anybody, and it can be any type of communication tools that they have. So if somebody wants to just pick up an old rotary dial telephone, they can access our servers 24/7. But if they get into technologies like smartwatches and smartphones, tablets, computers, even smart TVs, we really take that experience and that engagement level with that employee to the next level. So we have a number of different centralized healthcare options that is part of the platform. What we're really trying to do is we're really trying to drive new behavior, and we're really trying to get people to access our telehealth service. So kind of the elevator pitch is we have a 24/7 access to licensed doctors. They can call us up 24/7 anytime. Call us up. We guarantee that a licensed doctor will call them back within 1 hour. Our average callback time, believe it or not, right now is only 9 minutes when a licensed doctor calls you back, but in 94% of the cases, they're actually diagnosing over the phone and phoning in a prescription to any pharmacy if necessary. So we combine that with online prescription savings, with health management content. You can actually go on our systems and locate providers. You can shop and price procedures, and you can even manage your healthcare deductibles all in our system. So one of the powerful things that we do is we have that access to doctors, and we have it convenient, it's fast, and in most cases on it's free. So the AMA, the Wellness Council of America, they estimate that over 70% of the times that we go into a doctor's office, whether it's the emergency room, urgent care, or primary care, over 70% of those visits can be handled safely and effectively over the telephone. And that's where we come in. So you're going to get a few big questions. Who are these doctors? Are they in a call center overseas, or are they fresh out of medical school? And the answer is absolutely the opposite. They're very highly credentialed US-based licensed physicians. They average about 14 years experience, and they're all types of doctors on our network. Primary care doctors. We have a lot of emergency room doctors because they're used to seeing so many different types of conditions come across. We have the largest telehealth network in the country, and we're proud of that. And we're actually up and running in Idaho now. So the only state that we cannot go into is Arkansas in terms of actual consultations. But one of the other big questions you're going to get is, if telehealth is new to some of your clients, or even new to some of you on the telephone, is what can doctors really handle over the phone other than just sore throats and things of that nature? And if you look at the screen here, these are the top 9 reasons, according to the AMA, why people actually go into the emergency room to see a doctor in person. And these are almost identical mirror to the doctors that we have, or the conditions that our doctors treat on the telephone on a daily basis. So you can see how you can get to a very, very large number of conditions quickly and effectively, and it really drives up the overall utilization. In terms of telehealth and where we stand in the industry now, when we started this years ago, HealthiestYou, telehealth was very, very new, and it was a very foreign concept that people, they think that it's a great concept, and we'll kind of get into that a little bit more later in the presentation, but people were skeptical. Kind of sounded a little bit too good to be true. Well, those days are gone. Telehealth is here, folks, and it's here to stay, and it's very, very widely accepted. And if you haven't implemented telehealth into some of your clients, you're missing the boat, because they will have it. If they get it, unless they get it, they may get it from somewhere else, so why not get it from you first? To kind of back this up, Deloitte & Touche study estimated that with all the telemedicine companies in the United States, they estimated in 2015 there were about 800,000 e-visits. They estimate in the next few years that there'll be 300 million e-visits a year. So it's an explosive growth, and that's why we're so excited to be part of it at HealthiestYou. So one of the main things, and this is where you're going to see a huge difference from our competitors out there in the marketplace, we are passionate about educating your employees and engaging them and reminding them in simple ways how to use the service. And a lot of that education has to do with really re-educating them in terms of how they think. So we've been raised in the U.S. to kind of access healthcare in a particular way, and that way has always been in the past. If you need to see a doctor, go to your primary care doctor. It's going to average about $125. You're going to be exposed to germs from other patients. There's travel time going back and forth to the doctor's office, and the claim is going to hit their major medical. It's very important. Times are very, very limited for primary care. Obviously, you're typically 9 to 5, Monday through Friday. If that wasn't available, you were kind of trained to go to urgent care. $175 average, same types of limitations, a little bit longer hours, but still very limited. If that wasn't available, you were trained to go to the emergency room. Very expensive, averaging $1,200 on a nationwide basis. Same types of limitations. Yes, they're available 24/7, but typically long waits, very expensive, very inconvenient. So we train our members to start with HealthiestYou, and that can also be accomplished. I'll show you how to do that in a second in terms of the benefit plan design, how to really make that effective and make them part of their mindset. So why not start with HealthiestYou? Why not have us be that gatekeeper? Zero consultation fees for most of our products that we provide. You're not exposed to germs from other patients. There's no travel time. So you can do it from the luxury of your couch, or if you're working, you can stay at work and not have to jump in a car and go back and forth to a doctor's office. Very, very important. The claim will not hit the major medical. So now you're redirecting claims. You're making a valuable, powerful impact in that plan design. And obviously, it's available 24/7. So let's walk through the member experience. And this is one thing that we're very, very passionate about at HealthiestYou, is that we want members to have a positive, powerful experience, whether it's the employee, their dependents, their spouse, or their children. It doesn't matter. We want them to be happy because they're going to use it again. They're going to tell their employers about it, and they're going to tell their fellow coworkers about it, and they're going to keep us. And that'll show in some of the retention numbers that I show you. But we want to make sure that they're having a very easy, very powerful experience. So the first time that they're going to get with HealthiestYou, they can either schedule an appointment online, you can simply call in, or you can use our new smartphone app to schedule an appointment. They'll provide your medical history, so very similar questions to going in to see a doctor in person for the first time. So name, age, height, weight, drug allergies, past surgery, all that information's taken. Once that's done the first time, it's in there, stored in a HIPAA-compliant portal that is in there, so that if you call in again, you don't have to redo that. They can access it from your secure portal. The triage specialist will determine why you're calling in, and then they'll schedule a call with the appropriate doctor. The doctor will review that patient's history prior to calling the member back, similar to seeing a doctor in person. They review your history, and so they can make informed recommendations. If a prescription needs to be sent in, they'll send it in via eScript. Very safe, very secure, to any pharmacy you like. So we'll work with any pharmacy anywhere. We send it wherever that patient wants. The doctor will then update the notes, and then the consultations are stored in a very secure HealthiestYou member portal. So powerful, powerful statistics. We have a 97% customer satisfaction rate, which we're really proud of, because one of our sayings here at HealthiestYou is that we're not perfect, but we will respond perfectly. And what that means is that, hey, sometimes calls get dropped. Cell phone coverages from a member might get dropped, or a doctor might not get back to you quickly enough, but we'll make it right, and we'll make sure that our team is on that to make sure that member has a great experience, and that shows in our customer satisfaction. 94% of the medical issues resolved, meaning that 94% of the calls resulted in no further action. So that's big, big numbers, that we can take care of a lot of the information, a lot of the conditions over the phone quickly and effectively. Like I mentioned before, 9-minute average time when a physician actually calls you back, which is amazing. When you tell that to your clients for the first time, excuse me, they're not going to believe you until they actually try it. And I know me personally, when I've called in recently, I've called in for my children the last couple months 2 times. I've literally got a call back in 1 minute. Now remember, our average callback, or our guaranteed callback time is 1 hour, but you'll see it actually is a lot quicker than that a lot of times. We have a 13-minute average consult duration. This is important because this shows that our physicians are actually taking time. They're going through, they're being thorough, and the average in-person time with a physician is only about 3 to 5 minutes. So they're more in it's kind of a cattle call. They want you in the office. They want you to turn and burn and get you out of there quickly, where our doctors are actually taking time, and that that shows in terms of the customer satisfaction rating, in terms of how clients are being treated. We have a 95% client retention rate. This is huge. So this means that the employer groups, and I think now we're over 9,000 employer groups now that are part of HealthiestYou, and it just shows that they're happy. It's the very, very interesting part that we see with HealthiestYou and the clients, the 5% that don't retain our service. The vast majority of those are the companies have gone out of business, or they just simply can't afford any benefits, period, anymore. So it's not because of the lack of use or the lack of satisfaction with HealthiestYou, but the client retention is through the roof. And the powerful statistic is zero consultation fees and the vast majority of our services that we offer out there. So this is where things get really different, very, very different. So if you're new to HealthiestYou, or if you haven't seen the statistic, this is where I want you to forget everything you know about telehealth, because we're so different than anything you've seen out there in the marketplace. You can count our main competitors on one hand. There's probably 100 plus telehealth providers out there, but the big players there's 5 or less in the United States. But all of them except for HealthiestYou have the same strategy, go-to-market type strategy, and that is typically there's a copay involved, a consult fee, anywhere from $10 to $40. Every time somebody wants to call in to access a doctor, they're paying a consultation fee. If they are providing products that don't have consult fees, they really don't want you to use it. So they'll mail out a member ID card, maybe, because a lot of times they're actually charging extra to mail out a member ID card to that client. And then that's pretty much the last that your client and that employee is going to hear from them. So the strategy is give a real low per employee per month charge, hope that people don't use it, and give very little support to actually engage employees and remind them to use it. And that shows in our competitors' overall percentage in terms of utilization. And these numbers are backed up, and you can go on and see press releases to back these numbers up, but our average utilization from our competitors is running around 2%. So what that means is if you had a 100 life employee group that had telehealth with our competitors, only 2 of them a year are actually using that service. And we saw, when we started HealthiestYou and we were introduced to telehealth years ago, we saw that there was just a huge flaw in that go-to-market strategy and that logic, that you have this powerful service that we could go take a walk on the street right now and talk to 10 people and tell them that about the HealthiestYou service and would this be a value or would you like this service, and 10 out of 10 would say that's amazing. But if nobody knows about it and nobody uses it, it's a worthless service and it's a worthless product. And we saw a huge flaw in that logic and that thinking. So we really wanted to make a change in the industry and make a change in the way people accessed healthcare, and we wanted to really figure out how to engage and educate those employees and remind them on a constant basis. And because of all the tools and all the strategies I'm about to show you, these are 2014 numbers. So where our competition was at 2% utilization, we were at a 42% utilization rate. And that's not for 1 or 2 groups. That's for our entire block of business, for the 9,000 plus groups that we have on the books right now. So it's a powerful, powerful statistic. And when we get in our final numbers for 2015, that number is going to go up actually probably more to about 45 to 48%, which is amazing. So most of the time, and when you're kind of thinking to yourself, well, I don't believe that, and how can that be true? I'm going to show you how we do it. The first way we do it is with our pricing. So we were the first in the industry to come up with a composite price that did not include consultation fees. So you're looking at different pricing tiers here, where the most powerful thing about this pricing that I can convey to you is that there are 0 consultation fees. So members and their family can call as often as they want. They're never coming out of pocket. There's no hidden fees for consultation fees, for boarding, for any kind of access fees. It's what you see is what you get. So I'd say over 90% of our groups are employer paid, where the employers picking it up for their members. And the 2 to 99 life space, we're at $9 per employee per month. The powerful thing for this pricing, though, is that this includes the entire family. So this is spouse, children, all paying only $9 a month for 2 to 99 employees on that tier rate. Most of the time, like I mentioned, the employer groups are just building this into their plan. They're paying for it, simple and done. If an employer wants to offer this to their employees and maybe have them pay for a portion of it, they can do that. We're going to list bill that employer, and they can payroll deduct accordingly. So if you get into a little bit larger group, 100 plus lives, we're at $8 per employee per month. 250 employees per month, we're at $7. 500 or above, we're at $6. 1,000 or more, we'll get aggressive. We won't lose a deal on price. We've had a lot of success in 1,000+ groups. We just brought up, we're bringing on plenty of 1,000+ life groups. So if you have an opportunity like that, work with your HealthiestYou representative, and we'll make sure that we're getting aggressive. If an employer says, I don't want to pay for this, but I'd like to offer it at open enrollment, that's where the voluntary rates kick in, and that's where we get into, it's 11 for an individual, 15 for a family. We'll still list bill that employer, and they'll payroll deduct accordingly. So that's one strategy on how we really drive utilization and engagement. The second strategy, and this is very, very important, this is what Patrick and I will talk about in a little bit, but it's benefit plan design. And this is where our most successful consultants and brokers around the country are having an impact with HealthiestYou, because they're really making a difference in the way they're presenting themselves out there in the marketplace. So if HealthiestYou can handle up to 70% of all the times that we need to see a doctor, whether it's emergency room, urgent care, or primary care, over the telephone safely and effectively, it's 24/7 access. There are 0 consultation fees. We're going to show you in a second how you can sync up with your health plan and search providers and even save up to 85% on medication. Now you can build the entire plan around it. So you take your major medical plan, and you're really not doing anything, you're not selling anything differently. You're just redesigning the plan a little bit. So you're taking an HMO or a PPO and maybe raising copays or eliminating them altogether. You're raising deductibles. This is a perfect fit in with HSAs and self-insured plans. The whole goal is to take enough money from the major medical to not only pay for HealthiestYou, but come in and provide some other services that can be beneficial, like GAP, critical care, accident, cancer, even provide some ancillary benefits like dental, vision, or even life or disability. Our consultants and brokers who are using this strategy around the country are typically saving, so they're carving enough savings out of the major medical to not only pay for HealthiestYou, but pay for some other supplemental benefits as well too. They're going back to that employer with either 0 increase or maybe even a decrease on renewal. So the employer is extremely happy because they're not having to, we've all seen, I've been talking to brokers around the country, they're averaging 15-20% increases on renewal on their groups. So how would you love to go back to your group and actually have no increase or maybe even a decrease and actually enhance their benefit plan? That's what we're doing. So the employer is very happy. The employees are happy. I've been to countless open enrollment meetings where the employees are very happy with their benefit plan. And one of the big reasons is they have HealthiestYou now, because they can access the doctors and all of our services. But the brokers who are doing this are actually, a lot of times we're seeing they're actually doubling their first year commissions, because now you're not only making commission off of major medical, but you're making commission off of HealthiestYou, which is that 15% level commission, but also making commission off some of the supplemental products that you're selling as well too. So just a powerful, powerful strategy. This is where this is where my team comes into play, because this is where we really start to educate and engage the employer groups that we're working with. So every new group that's brought into HealthiestYou, I mentioned we have over 9,000 employer groups. Every one of them is assigned an account manager with HealthiestYou, and every one of them gets a personal touch. So we don't care if it's a 2-life group or a 20,000 life group. They're going to be assigned an account, a dedicated account manager who will work with that that admin at that particular group. They'll reach out. So we're going to mail out a member ID card, and that's where our competition stops, or where they mail out the ID card and they're done. That's where our team really starts. So they'll reach out and they'll ask the employer, how can we help you best communicate with your group? So, for example, we'll ask them for their email addresses. We have a campaign of emails, that a library that goes out. It's all automated, that will constantly remind that employee on a monthly basis that, hey, for example, it's cold and flu season. Remember, you can call HealthiestYou free of charge. It's summertime. You're traveling on the beach. Remember, you can call HealthiestYou. We'll do monthly marketing campaigns that go out to them. We'll do custom marketing campaigns where we're actually using that employer's logo or their name, because we find that employees are actually more responsive to communication that's coming directly from their employer. We'll get creative. We'll ask group administrators to attend webinar campaigns. Like we had a campaign where you send out one flip-flop, and if you attend the webinar, you get the other flip-flop sent out to you. So all kinds of creative ways to really engage the groups and the employees. We'll do reviews of utilization where our competition will kind of hide from utilization. We have it out in the market, right in your face, and we're actually doing reviews to make sure that groups are attaining the utilization goals and the redirection goals that they want to achieve. And we'll show you, and Scott will actually show you that in a second, where you can actually log on and see real-time utilization reports. But so the 42% utilization that I showed you for 2014, that was actually prior to the launch of our new app. And this is kind of our new baby that we're very, very proud of, and that app and the utilization and the tools, the client engagement is just going to go through the roof. And I'm going to pass the screens over now to Scott Sanford. He's our Chief Growth Officer, and he's going to show you an actual demo of the app
So Eric, I got the controls. Thanks, buddy, and thank you everybody for joining the call. It's great to have everybody here joining us, taking time out of your busy schedule in this new year. But with the demonstration here of our technology, if there's one thing I hope you all take away from this, is that we are very serious about utilization at HealthiestYou, because we know the impact it has with driving down the claims. I mean, Eric's been driving that home here in the discussion. I like to share a story about an 80,000 member association of 1,500 different employer groups that we rolled out 1/1 in December 2015. The team here, our client success team's making 140 calls a day just for this one opportunity rollout, reaching out to every HR director at all 1,500 companies, making sure they're aware of HealthiestYou. They got the marketing materials, they're excited, and we kick this thing off with great utilization in the highest healthcare utilization time of the year right now, which are these winter months. So we're serious about driving up utilization, and that's why we're the highest utilization product in the market. The technology here just kind of drives that home. Let's talk about geofencing here for a moment. This is a new technology for healthcare. There's one place in the world where you have geofencing attached to a telehealth and engagement technology, and that's at HealthiestYou. Nobody else has this. I'm going to paint a picture for you here, a real-life scenario that maybe many of us have been in. Let's say it's 10 o'clock at night on a Sunday. Maybe it's one of your employees with one of your clients, right? And they're walking into an urgent care center because they've got this nasty bronchitis that's going around. It's probably the #1 reason that people are calling in today, this month, because it's just that time of year. You've got work the next day. You got a busy week coming up. You got presentations. You walk into an urgent care center because you think that's your only solution, because you forgot you had HealthiestYou, because you missed that part of the open enrollment presentation or whatever that may be. But your phone beeps and vibrates because we know you're in an urgent care center, because we plotted all those locations by latitude and longitude into our technology. So when you walk into that fence, that sphere, we know you're there, and the benefit reminder pops up. Okay? Maybe there's 20 people in line in front of you, and you got to wait. Maybe you're on a high deductible, and you're going to pay close to maybe $200 for that visit out of your HSA because your deductible hasn't been met. All the germ exposure, that wonderful experience we've all been through, but your phone beeps and vibrates, and it says, it appears you're in an urgent care center. Well, we have doctors waiting right now to do this consultation with you, just hit this green button and we'll get you connected. Wow, what a savior that is for a lot of people, right? It reminds them about HealthiestYou. Next time they won't forget they have it, and we're going to continue to drive down costs within that plan. It's an awesome technology. We do the same thing with pharmacies because we've got an incredible pricing engine, and I'm going to show you here in about 5 seconds on the app, that prices all the medications for you, finds the best cash price for you, beats your co-pays 7 out of 10 times. So why not remind you, if you're at a pharmacy, if you're there to pick up medication, don't forget to price that out with us, because we know you're in that pharmacy, and we want to try to save you some money and keep some unnecessary claims out of that health plan. All right, I'm going to go ahead and sync my phone up here to the screen, so give me just a second, and we'll do a live app demonstration here. Hopefully y'all can see that. If you can't, reminder, use that chat box on your GoToMeeting control panel there. Angel's standing by. She's been answering questions. You got questions, shoot them into us. We'll try to get a response right back to you. If you're having any tech issues, let us know. But you should be able to see my phone here on the screen. I've got the HealthiestYou app up. First time you download it, walks you through a little tutorial. We like you to sync your health insurance provider. Doesn't matter if you got, Aetna, you got United Healthcare, Humana, pick one. Put in your provider, your group ID number from your health insurance card. We're going to sync that up, and we're going to expose some neat features like where your deductible stands, finding a provider. So when you land here in the app, you've got your shortcuts. So maybe you just want to talk to a doctor, right? You got geofenced and you want to do a consultation with that doctor. Just hit visit the doctor, request that consult. We'll dial you back at the number you want to be reached at, and you're off and running and getting you on that consultation with the doctor. So there's some shortcuts there. We're going to remind you about tasks. Have you completed your medical history yet? I've done a pharmacy search. I've got a discount card here popped up from a pharmacy search I did. We're going to keep those on your main page there when you do that. Got a couple of fun quotes here to keep you thinking about being healthy, keep you focused on the new year. Dr. Kelly's video lesson. People love these. We kind of rotate good, healthy content in there to keep you focused on being out of the doctor office. She's great. She's a former medical director at Google, Stanford-trained physician. Her content's in there for you. Radar's a great one. I had to use this summer when my daughter broke her arm, unfortunately, to find the closest urgent care center that's in my network. So the goal here, keep you in network so you don't pay too much by going out of network. So what's populating here on the screen are all of my in-network options based on my health insurance coverage, and I happen to have a plan through United Healthcare, so it's showing my network options here. I can narrow the search, right? Here's all of them. Here's doctor offices. Pick one by you. Here's Greyhawk Family Practice. What's the details? So we're going to click details. A little pop-up's going to come up and remind you that, as a reminder, make sure to always call first and confirm that doctor's still in your network, because they do change. They come in and out. It's kind of a fluid situation there with the doctor. So always call first. We're going to merchandise telehealth up top. Okay? We know you're looking for a doctor, so why not remind you that we have our doctors waiting 24/7. If this is something that can be resolved over the phone, click it now. Let's save you the visit. But we know 72% of the people in the country don't have a primary care doctor yet, so we want to help you find one and make sure you're doing those well visits and still seeing your primary care doctor. Just keep HealthiestYou in mind for those acute issues that can be taken care of over the phone. So this doctor here, you've got the Better Doctor rating, 4.5 out of 5 stars. We pull that data from Better Doctor. All they do is rank doctors. And they look at their malpractice history here, if there is any. They check their licensing, making sure that's up to date. This doctor happens to rank in one of the top 20% of doctors nationwide. Well, that's pretty good to know if you're trying to make a decision on a new physician around you. You know, the office locations here, the background, where they went to school, their specialties. So a little more content that you might get than if you went to the payer's website, just to help you make the decision. Of course, we plotted on a nice map here, kind of like Uber, to make it easy to find something around you. Here are the urgent care center options here. Looks like I got booted off my screen. Let me bring that back up. Your urgent care options by you, your hospitals, your pharmacy locations around you, and even your veterinarian options right here for you to easily access. Then we can hit our apps button here and just see some of the nice features. Again, you can visit the doctor. You can do a provider search by list if you don't want to do it here on a map. You can price out medications. This is a really popular feature. I mean, so many people are on high deductible plans or have stripped out pharmacy benefits. So just type in any medication. My family, just a quick story, I mean, I've got 4 kids, right? I've never run a pharmacy claim through my health plan, always use this app, and I've always found a better deal on medications just from my personal experience. So what this just did is it shopped multiple PBMs, all the pharmacy locations around you, and plots lowest to highest on price for that particular medication. Maybe you like Target, click Target, add that right to your passbook, show them the discounts here when you're checking out. That's the cash price you're going to pay for that medication, $4 in this example. So maybe your copay is $15. You saved a lot of money there. It's easy. It's simple. Reduce claims in the plan. At the end of the year, what do we want to do? We want to send you with information to see your clients that shows fewer doctor office visits and fewer pharmacy claims in the plan. We want to make you the hero at the end of the year. That's our ultimate goal. So that's a fun one there. Pricing of procedures. Just pick any procedure. We always do an MRI. People are kind of familiar with that one. And we can shop this by insurance. So what this is going to do is give you a list. We'll do brain MRI. So how much is a brain MRI in my area based on my health insurance coverage? So low, average, and high cost, that's the paid. Okay, you can see the submitted cost here down below, low, average, and high. Okay, it pinged the United Healthcare server in that example, because that's who I have. If you've got Humana, it will ping their server and show the cost for that particular procedure in your area. So if you're paying out of pocket, maybe you're paying out of your HSA, you know how much this is going to cost, because people don't know if a brain MRI is $500 or $50,000. They just don't have a clue. So we're providing some nice transparency there for the member, so they can see what's going on there with pricing. Then you can click the check insurance button here. This is going to bring up your deductible, your where you stand, individual or family here. So looks like mine just reset here. Our plan just reset, so I'm back to 0 on everything here. It shows your coverage overview. Any copays will be itemized here. Of course, I've got HealthiestYou, so I'm on a plan that doesn't have any copays because we do almost everything over the phone or video. So it's going to show 0 there. But if you have copays, it itemizes them out, so you always know what your plan, your health plan explanation of benefits are, and the overview of that particular plan. We've got some cool motion stuff we're testing here. This one's not live. I've got this on my app because it's a test module. We are going to be syncing to the multiple devices out there, the wearables, the Fitbit, the Jawbones, the Stravas, multi-billion-dollar industry out there in the wearables tracking activity. You can sync that dashboard, that information here. And we're also testing our own HealthiestYou band, which is pretty cool, with touchscreen swipe technology. Geofencing notifications show up. You're getting close to your deductible and notifies you on the band. Some things we're testing here that's going to be cool for 2016. Always pushing the envelope to expand further into care and make sure we're doing the best we can for people to bring clarity and drive down costs. Circles tab here is simply your shortcuts. Maybe you got your favorite primary care physicians in there. Bam, you can get to them quick. Maybe you've got a specialist you like. Maybe you've got medications that you want us to shop continually for you. If a price change pops up, we'll notify you and let you know there's a better deal somewhere, always working on your behalf. So that's a quick overview of the app. Again, all about engagement, all about utilization, getting people to find easier, more efficient ways to resolve their healthcare issues, because it's exciting to reduce costs, which is just something you don't hear in healthcare today. Costs continue to rise, access continues to be more difficult. HealthiestYou's coming in to ease some of that pressure off and really make a big difference on that. Now I want to talk real quick about data. We're data junkies, so we want to arm you with information about your groups so you can come back and say, here's what HealthiestYou's doing to change the delivery of care within your plan, and here's what this means. So we have our client portal that our client success team is in every single day, working with groups, talking about utilization, providing reports to you so you can meet with your groups. I brought up a group here that's live. It's a little bit bigger group, 2,738 employees on this particular plan, representing a little over 5,000 total members with dependents. They've done 1,094 consultations through December. They've already hit 40% utilization, so they're going to break that, maybe end up at that 45 to 50% utilization here at the end of the year, so they're right in our sweet spot. Here's the redirection rates. We ask members when they call in, what would you have done if you didn't have HealthiestYou? Let's go back to that bronchitis example I kind of walked through at the urgent care center. If you didn't have HealthiestYou, probably would have went into an urgent care or an emergency room. Now let's crunch some really quick numbers here. This group, they're doing a lot of calls 10 p.m. to 6 a.m., 33%. Well, that happens to be the time that the emergency room's open. Well, look, that happens to be right about 33% of the total visits are emergency rooms, correlates to the time of day that people are calling in. Well, if your average emergency room visit across the country is $1,300, take that times 362, that's $470,600 in emergency room visits saved alone. We haven't even talked about urgent care or primary care yet. This group's not paying anywhere near $470,000 for HealthiestYou for the entire year, and they're saving more than that just on the emergency room redirections. We haven't even talked about productivity, absenteeism, getting healthy quicker, less travel times, all the things involved with that. Here are the top 5 reasons that people were calling in for this particular group. Top 5 medications. Again, the times of day of the calls. It's interesting, 6 a.m. to noon is the lowest percentage. They're in the evening hours and afternoon primarily. The breakdown here, just some high-level numbers to show an ROI. Some of these are pretty conservative. $608,000 savings to date. They still got a few months to go on that. Top 5 locations by consultations here. We got a little heat map, so you can bring up the maps. #1 complaints by state, calls by state. So this data, again, this type of data doesn't exist with any telehealth provider. It's another first for our space. Real-time data here, you've got at your fingertips to come in with your client, show them that you are on top of technology, you're looking out for their best interest, and you're driving engagement in a technology that's completely changing healthcare. So with that, I'll go ahead and pass this back to, or actually, Eric, why don't you just right-click your name there, take the controls back. We'll wrap this up. Can't wait to get Patrick Kelly on the line. He's one of our benefit plan design masters out there. He's really taken HealthiestYou and used that as a key tool to get creative on benefit plan design. So we invited him on here to show you exactly how he does that, kind of give some of his trade secrets. We had to buy him a couple beers for him to do that, but he's real creative with it. We're going to get him on in a minute. But Eric, I'll pass it back to you, buddy, and we can wrap up before we bring Patrick on.
So, folks, this is Patrick Kelly. He's one of our. He's with Paragon Partners. Who's one of our. They're one of our best partners on a national basis. And the reason why we brought Patrick on today is they are masters of really understanding benefit plan design on a number of different levels. So, not only being able to really retain their existing clients, but really be aggressive, go out new clients, and doing it in a way that's retaining the business that they have with their carriers, but also going on and bringing on a lot of supplemental products and really, getting explosive growth through their general agency and for the brokers that they work with. So, Patrick, you want to go through kind of a strategy and talk about how you use HealthiestYou to open doors, but also in a strategy and overall benefit plan design.
Absolutely. Thanks, Eric. Hello, everybody. Once again, my name is Patrick Kelly from Paragon Partners. I'm part of the sales team here. And, our #1 goal at Paragon is to add value to brokers. And I would say over the last 3 or 4 years, HealthiestYou has been at the forefront of that. The reason for that is simply because, we're always trying to give our brokers ways to open new groups and, like Eric said, retain their current block of business. HealthiestYou, because it's so unique in terms of everything that they do and it's so cutting edge, and because their utilization is so high, it's become probably the #1 way for our brokers to get in front of new groups in new and unusual ways. We've created scripts for our brokers. That's been a great way for them to go out and cold call certain groups that maybe in the past they've been unable to talk to because we all know it's hard to just cold call a group and try to talk about their benefits. But when a broker calls up and says, well, no, I don't want to talk about your benefits, I want to talk about something else that you've probably never seen before, it's been a great way for our brokers to get in the doors and get appointments.
I'm on mute.
So another thing we do at Paragon is we're constantly trying to come up with different plan designs to be able to not only offer better benefits to our groups, but also it's always a good thing to do is increase commissions for the brokers. So I'll give you an example. Yesterday I was talking to a new broker. He's just currently starting to work with Paragon, and he showed me a small little group, a 5-life group, and it was he wanted to show a $1,000 deductible to $4,000 out-of-pocket health net plan. The total premium was around $3,000, and what I suggested to him was, why don't we try a different strategy? I showed him a United Healthcare plan, a $2,250 deductible to $6,350 out of pocket, which saved us a lot of premium. With that premium, I was able to put in HealthiestYou, gap, critical illness, and accident for the literally about pennies, same premium as the health net plan that he wanted to show. So for the same amount of premium, for the same amount of employer cost and employee cost, I was able to add HealthiestYou, gap, CI, and accident, which then made the employee 100% inpatient, and it gave them the ability to call a doctor 24/7 and save money that way by not having to go see their doctor in most cases. Eric, do you have anything to add to that?
That's great. Yeah, no, and one of the things that I think is powerful as well too for the folks on the call today. What's your overall experience been, Patrick, with the service itself and then working with the team from HealthiestYou?
Oh, it's been second to none. I've had an example where the owner of a group gave me a call and said, I'm sick. I called HealthiestYou and it's been about 15 minutes and I haven't gotten a call back. And I said, okay, well let me see what I can do. I gave Angel a call, and the doctor I think called him back within 3 minutes. And that's on the high end in terms of what the average is. Like you said, the average is about 9 minutes. I have a personal experience for myself where I called and for my kids had pink eye. From the time I timed the call, from the time I called and had a call back, it was 4 minutes from when I had my prescription written. So in that instance, it's been great. But in terms of the service with HealthiestYou and your back office, we implement probably 10 to 15 groups a month with you through our office, and I would say it's a 1 or 2 day turnaround in terms of getting a group installed. Eric, I know the example from last week when I called you. We had a 1-1 group that was in, but it was 12:28, and the owner gave us a call and said, "I'd like to make a call today," and you guys were amenable to that, and you got him in the system that day, so he can make his call that day, and that's pretty powerful.
I appreciate it.
And when a broker can talk to their client and say, "Hey, I can get this done for you," and because he has a relationship with you in that way, that's pretty powerful for the broker and for the client.
That's great. We appreciate it, Patrick, and we appreciate all the partners on the call today. Thanks for taking time today, Patrick. So it kind of leads into closing up the webinar, and thank you all for taking time out of your valuable schedules. But the question is, what's next? Who if you're new to HealthiestYou, or maybe you're kind of looking for ideas on who to go after, even if you're working with HealthiestYou already, we're having a lot of success in a lot of different areas. So even if it's a little bit outside the box, work with your HealthiestYou representative. We may be able to help you get something done, but we really encourage you to work with your HealthiestYou sales representative. When brokers get us in front of their clients and go through presentations like you just saw here, we have around a 90% close ratio, and those numbers are real. We can't expect you, if you're consultants and you're brokers around the country and you're representing dozens or maybe even hundreds of different lines of insurance, you can't be expected to be an expert on all of them. So don't be afraid, don't be shy. We're here to support you. It's important to know that HealthiestYou, we do not go direct to consumers or end clients, period. We only go through agencies, consultants, partners like yourself on the phone. But we know that we really need to step up and support that, and we do. So if you need help with presentations, if you need help putting together proposals, let us know. Obviously, going after fully insured, self-funded plans, those are the kind of what we've been talking a lot today. But we get into a lot of MEC limited med plans. We've had a lot of success in the TPA space, in association space. If you have an opportunity, especially a larger opportunity that you need help with, reach out, get in touch with us, use the HealthiestYou team. You can get started. Number one, go to the HealthiestYou partner portal. Up in the upper right-hand corner, you'll click on partners, register. You'll get a partner portal that's amazing. There are proposal generators there. There's email campaigns. There's ROI calculators. All of the presentation you saw from today, any kind of marketing sales materials there, all the information on enrolling in employer groups with the employee apps and the census, everything's all there. Even your own customized site will be built. Once you register on this partner portal, you'll have a custom site that is for employer groups, and you'll also have one for individuals where you can sell the product on an individual basis, where we'll collect their credit card information and bill them. I know Patrick had talked about, and Scott and I both talked about the service, the HealthiestYou service. We want everybody on this call to have the HealthiestYou service. If you're going to be representing the company, it's powerful to have your own stories. And to make that happen, we give you, as a registered partner with HealthiestYou, we give you a 30% discount on the service, because we're kind of putting our money where our mouth is, and we really want you to have the service. So we're giving you a heavily discounted rate. So we highly encourage you to not only sign up for the partner portal, but get the membership as well too. And then finally, I mentioned use our broker support team. That's what we're here for. The entire sales team at HealthiestYou is here to make sure that everyone is being taken care of, that we're showing well in front of your clients. Use us. We will do a great job, and we'll make sure you help close business. So kind of wrapping up where we started, we want you to trim the fat from your existing clients' health their plans. So we want you to go out, have a very successful 2016. It's just poised. HealthiestYou is poised to explode. The train has left the station. Make sure you jump on that. Come along with us for the ride, and we look forward to working with all of you in 2016. Thanks for joining the call, and have a great day.